Malaysia has got several good things going for it. Firstly, trained manpower. They've got good doctors, they've got a lot of nursing schools that produce nurses, and as you know, there's a worldwide shortage of nurses. So Malaysia produces quite a lot of nurses, right? Doctors as well, who are all very well trained from the different medical schools, specialty training. So that's the first thing. Secondly, I think is just rising sort of affluence, right? In Malaysia, you'll see it, a lot of people coming to the private hospitals. Thirdly, increasing penetration of third-party payers, insurance. Insurance about 60 to 70%, right, of healthcare, right? So I think these are all the sort of the factors that are favorable for Malaysia.
Right. Because you operate in so many different countries, Malaysia, Singapore, and a huge network actually in Europe, what do you think are the differences between the challenges that these various healthcare systems are facing? Because perhaps it's correct to assume that the challenges that Malaysia or Singapore or Thailand are facing might be different from what, say, a Netherlands or, say, an Eastern Europe might be facing, for instance.
Well, I would say countries like Malaysia and Singapore, we've got a good balance of public and private healthcare. That's not always evident. I mean, if you look at Europe, right? Europe is very big in socialized national healthcare systems, right? Private healthcare is not very big. But if you look at Singapore, the 4 hospitals that we have here, Mount Elizabeth, Gleneagles, and a good public sector as well. Likewise in Malaysia, it's the same thing, right? So these are countries that I say have a good balance of public and private healthcare in terms of access for different segments of the population, all right? So Europe is very different. We also have got big operations in Turkey, as you know, right? We run a private healthcare group that caters to what I call the A+ segment, so right at the top, right? But they've also got good public infrastructure as well.